past year, life has changed drastically due to the COVID-19 pandemic. Kids across the country have lost social interaction by not participating in school, on campus, or other curricular activities. Several companies released a COVID-19 vaccine in late 2020 in the hopes of stopping the spread and getting back to normal life. With much apprehension about taking the vaccine, I reached out to an infectious disease doctor to learn more about COVID-19, how it spreads, and why the vaccine works.
So I'm an infectious diseases doctor. I take care of people with infectious diseases, and I'm also the medical director of the California Department of Healthcare Services.
Dr. Karen Mark is helping to make a difference during the COVID-19 pandemic.
Our department runs the Medi-Cal program, which pays for doctor's visits and other healthcare for about a third of all Californians, including about half of all kids. So about half of all kids that go to your school. And I'm working with other people in the department to help make sure that we can get the COVID vaccine distributed to everyone on Medi-Cal. The COVID-19 is a virus, and it travels from one person to another in little droplets. So when someone who has COVID coughs or sneezes or talks or even just breathes, little droplets come out of their mouth with the virus. And those droplets can land on someone else's mouth or nose or eyes. And that's how that second person gets infected with the virus. That's why we wear masks, because the mask prevents the droplets from touching your mouth or nose. And like if I have COVID and I wear a mask, then it keeps the droplets all with me so they don't travel to other people. One of the ways that our bodies protects us from all infections, including COVID, is we have something called an immune system. And our immune system, when it sees COVID, we have some cells that like gobble it up. We have other cells that like see the virus and they say, oh, I know that's not part of me. And then they put a little flag on it. And then other cells will like kill those cells with the virus. And that's how our body fights infections. But it takes several days to several weeks for our bodies to develop that immune system. And after we have COVID and after we develop that immune response, we have certain memory cells that always stay with us and remember that virus. So if we get all better from COVID, we have those memory cells, and that helps protect us from getting COVID again. The vaccine works because it tricks our body into thinking we have the virus, even though we don't. The coronavirus actually means crown. And that's because the virus has these little spikes on it. And the COVID vaccine has a little code that creates just like one of those little parts of one of those spikes. So when we get the COVID vaccine, the body makes just that little part of the spike. And then our immune system recognizes that it's not part of us. And then it develops that whole immune response to it, and it develops those memory cells so that we have those memory cells, so that even though we didn't get sick from the vaccine, we still have the memory cells and we can fight off, if we get exposed to the actual coronavirus. So before the vaccine was distributed to the public, it was tested in lots and lots of people to make sure that it was safe and to make sure that it works. And it passed all those tests. So it showed that the vaccine works and that it is safe. All that data from all those trials were also reviewed by the Federal Food and Drug Administration and also the Federal Centers for Disease Control and Prevention. And they both also determined that it's safe. Getting the vaccine is a lot safer than getting COVID. So I'd rather have like a little bit of a sore arm for a day than, get really sick from COVID or maybe get COVID and pass it on to someone else. I've gotten the vaccine myself and it wasn't bad. I got a little bit of a sore arm, but other than that, I had no side effects at all. And I will also share that as soon as I can get the vaccine for my mom and for my kids and my other family members, I'll make sure they get the vaccine as well. So I feel very confident that it's safe. I just want to remind everyone how important it is to continue to wear a mask and stay 6 feet away from people and wash your hands. Even after people get vaccinated, we have to still continue taking those safety precautions for a while.
Encouraging the adults in your life to get vaccinated, kids can get back to learning on school campuses. They can take part in extracurricular activities and begin socializing like they did prior to the COVID-19 pandemic.